Hi, my name is Julie Edler. I'm one of the physical therapists here at Bethesda Medical Centre in Haiti. I'm here with Dr. Rodney, the director of Bethesda Medical Centre, and I'm just going to ask him a few questions about what's going on at Bethesda. Good morning, Dr. Rodney.
Good morning, Julie.
How are you today?
I'm good, really good.
Good. Could you tell us a little bit about what's been going on in Haiti over the last few months and how the events that have happened in Haiti have affected Bethesda?
And it's really sad to talking about what happened in Haiti now, because like 3 months ago, our president was died. They killed him in his house, and that's make it difficult. Now we can say we don't have a government, and so things really difficult. We have a lot of violence and kidnapping things happen, and also we have difficulty to find the diesel from make the transportation very difficult, and food cost of the food it's increased. That's make the life of people in Haiti very, very, very difficult now.
And how would you say that has affected the lives of your patients, the patients that come to Bethesda? Has that changed for them? Has that changed anything?
Yeah, the way that affect our patients, most of a lot of people losing their job because some of the institution closed because the insecurity, and it's also the transportation for the patients, because patients who come into Bethesda, they form in different area, but now it's transportation is very difficult and costs a lot, and also the nutrition of our patients come in very difficult because the cost of the food it's increased. That's make the life of our patients very difficult, even to buy medicine also.
Thank you, Dr. Rodney. Could you give us a little update on the work at Bethesda, the kind of patients you're seeing? Have you made any improvements this year? Tell us just a little bit more about what's been going on at Bethesda this year.
And this year, if I want to start with our service of X-ray, we have two new X-ray machine, and that's really good for us because we have a lot of accident happen in Haiti because people use motorcycle as a taxi. That's increased the quantity of accident, and most of them needed X-ray. We're so glad we can offer the X-ray service to the north of Haiti, and we not only make an X-ray for our patients, we do for outside patients and all the little clinic around us. We do that for them also, and also we add the chemistry tests in our laboratory. That's something we started this year. Some of those tests we can do now at Bethesda. People they should send them to the Port-au-Prince, and sometimes they will have the result in 15 or 1 month to have the result back. Sometimes the patients die before the result die, and now we can do those tests in Bethesda. And also that's really good in our PT clinic physiotherapy. We really now focus to how we can help better the children and kids who have problems and some issue and brain and things. They have some difficulty, and we focus on that, and we help a lot of patients with stroke, because we high blood pressure. That's one of kind of patients we see a lot. Patients with diabetes and high blood pressure, and we help them when after they have a stroke, and that's something working very well and Haiti now. And also we offer the best service of the dental service and our service and different area. And now our clinic start to give a vaccine for COVID-19. That's one thing we start with it. It's really good. We can have that vaccine in our clinic. We can offer to protect our people.
Did you get your COVID-19 vaccine?
Yes, I did. I take it here, and that's I'm just waiting to have the second shot for the COVID vaccine. One of very good things too, most of our staff start to take the vaccine. That's a very good example our staff, because some people they have a difficulty to take the vaccine, but people's working at Bethesda they really start to take the vaccine.
Great. So, Dr. Rodney, could you give us an example or tell us a patient story or testimony of someone that Bethesda has helped just recently?
One of the sad and an amazing story. We have visited a young lady, 21 years old. She was pregnant, and after she delivered the baby, she's become very anemic, and this baby suffered the malnutrition also, because malnutrition is one of the big problems we have here in Haiti. 1 of 5 children and so suffer the malnutrition, and so this young lady, she come in our clinic after it's delivered the baby after 3 months, and we saw her. She's really sick and anemic, and even this baby's and malnutrition also. And so after that, and we gave a medicine to her for the anemic things if she leave. When she come back, that's one thing surprised us, and we don't say nothing, we don't preach her, we don't even present the Jesus to her, and she said she want to accept Jesus because she can see. One things we learn from this story, we don't have to tell people, and we can show them Jesus. And I think that's one thing Bethesda try to do. Through medical care, through the support we give to people, we show them the love of God. And this lady now is accept Jesus in his life.
That's wonderful, Dr. Rodney, and that's what our mission is, right? Sharing the hope of Christ through compassionate healthcare, which is what we're trying to do. So big question, are you still going to move and build a new clinic?
So even we offer to our people a very good service, we have a very good staff, but we have some problems because where we are now, the facility we use, the clinic we have, it's very old, and our goal is giving excellent care to the poor people in the north of Haiti. With what we have now, we can't do that. Bethesda and our board decide to build a new clinic. This is the good news, and it will happen, and I think this new clinic will help our staff to work in better and to offer a very excellent care to the poor people. We already have the land, we buy the land, we pay the land, and we start the construction of the wall, and we will start with the phase 1 of the construction, and so I know we can wait to be in this new clinic.
So how will this new clinic better serve the people of Haiti and our patients who are already coming to Bethesda?
And the way our new clinic will help, if I can take an example, in our PT clinic it's too small because we have just one rooms to do everything, and that's where we have the kids there, an adult. We need a place to make a education to the people because education would really very important. We need a place to make exercise, and so I think when we have the space in the new clinic with all those space, we'll lack for the PT, we will give a very good service to our patients. Also, that will help our laboratory because we add the chemistry test. We will have a better place to put all our equipment to keep them stable and with a good temperature, and that will give a very good result. If the laboratory gives some fast result to the test, that not will help our patients, but we think in the future we will give a very good result to the care we want to give to our patients. And also the way that will help, will have in this project not only the building, it will be about having new equipment too, and because now we miss a lot of equipment, but in this project one thing is build the clinic and also put the new equipment in that building, and that will give a very better care to our people in Haiti.
Well, as one of the PTs, I am really excited about getting a new clinic and a bigger space and just somewhere more fit for purpose to treat our patients. So when do you hope to move? So
I really hope we can move by before May 23, and so if that can happen, and so we will give a lot of glory and praise to to the Lord. That will very good for our staff, for our patients, and for the people in the north of Haiti.
Okay, so just about 18, 19 months away, not too far.
Yeah.
So it's a big project, and we're really relying on God. And how can anybody watching this video get involved in building a new Bethesda?
Yeah, I always say that everybody can be part of what God doing through Bethesda in Haiti. The first way, we need to pray for that. We need to pray. We know a lot of people already pray for us, but we really need people involved in group of prayer. You can do that in your family and your church with friends, neighbors, and people. You can invite people to join us and with prayers, because we want God to lead us. We want to do things in the view of God. We want to have the revelation how God want this ministry. It's not only this new clinic, but the way we will God want to lead us and help us and protect people who will be working on that project and make things happen in the way God really want them happen. And the second way people can involved, and in the future we will need the teams, and we need the medical teams, we need a team in construction. If some people have some skill, they can come and they can help us. And so we have some other part of the construction. It's a different building we will build, and we will need a team like that. If some people in the church want to make a team, can help us, it will be good. The third way, it's if you can come, so you can make a donation, because we need money to make this happen. We need a lot of money, because it's about 4 and 5 building for the new clinic, and so we really need your support. And so some people can donate some equipment too, because we're looking for equipment for this new clinic, and that's all different aspects, and people can contact us, and we try to involve in what God doing in Haiti through Bethesda Medical Center and incubation. Keep praying for us. Remember, we have a wonderful goal. It's giving excellent care to the poor people in the north, and we want to do that through the medical care, the kind of care we want to offer them. The way we treat them, they can see the love of God, and we can share the good news with them. And we know we have a very good staff here, and so, but we can't do that without your support, your prayer. And remember Bethesda in your prayer. And so thank you again for all your support.